everyone. Welcome to the Holistic Birth Podcast, where we put the power in families' hands to have the safe, satisfying journey they deserve. My name is Allison.
And I'm Brigitte. We are two doulas who love bringing information along with inspiration to help you feel confident and powerful in your choices throughout the birthing year.
We cover all topics around pregnancy, birth, and beyond. We're so glad you're here.
Let's dive into this week's episode. Welcome back to the Holistic Birth Podcast. This is episode 8, and today we're going to be talking about autonomous birth in the hospital. So this is for those who choose to give birth in a hospital for whatever reason, whether that's if you're transferring, if it's more last minute, or you're truly high risk, want epidural options or anything like that, you still deserve an autonomous birth, and that supports you as a whole person, mind, body, and soul. We want to help equip you in having the most positive birth experience.
Yeah.
Yeah.
So, first we could talk, I think it'd be important to know that you can choose the hospital that's right for you. Most of the time you have more than one option, and you kind of could ask yourself too, like, how far are you willing to drive for a choice that feels like a better fit for you? But learning which provider offices are affiliated with which hospitals is helpful. Asking specifically those offices what their cesarean rates are, their episiotomy rates, kind of getting a sense of what their practices are like and what their outcomes are like is good. And then taking a tour of the actual facilities is usually an option. During COVID, they kind of squashed in-person tours for a little while, but I know a lot of them are bringing that back. So whether it's virtual or in person, it's really good to tour and get all your questions answered. And then see what other people are saying about that specific, hospital or the provider office. Get on the moms groups on Facebook or whatever it is to kind of get the dirt, have the people spill the tea about their experiences with those places, because it can kind of help to know who can vouch or kind of expose certain trends with a certain provider or hospital. Yeah. I feel like movies tend to demonstrate to us that birth has to be or is always this very fast and dramatic situation. Birth can be, eventful, of course, but I feel like, I don't know, there's always the water
it's
breaking,
like gushing water coming out, and then 5 seconds later that the hospital screaming and
right.
with their legs in the air kind of thing. So it's not entirely accurate.
It's not. It's very. I don't know if I've ever seen a birth scene in a movie where I'm like, that was actually really well done.
Yeah, no, I don't think I've ever seen that either. Not ever. Not TV shows.
Right.
Yeah, it's totally different than what they portray. So
I think the only time I was ever like, oh, Hollywood did okay.
Sorry about that. If anybody heard the giggling baby, sorry about that.
Yeah, I think the only time I ever saw a scene that was sort of pretty decent was this I think it was a documentary I saw on Netflix. It was Pieces of a Woman. Have you seen that?
I haven't seen that. No.
It is trigger warning, it is about loss, and it was a very specific situation. I actually wrote a blog about it a while ago because I wanted to pick it apart and talk about it.
That's cool.
So you might want to wait until after your babies arrive to watch or read the blog post or whatever, but it was the only one I saw that did a decent job of showing what labor can look like. But still, it kind of gives us the idea that the second you feel a twitch of labor, you have to rush on in. And for people who are seeking an autonomous, more holistic, family-centered kind of birth experience, which is most of our listeners, I think, it's really helpful to know that you can wait until more active labor to head in. When your water breaks or when you're first getting your first few contractions, it does not mean you have to head on in. With precipitous labor, which is when labor starts and then ends with the birth within 3 hours or less, which is ridiculously fast, right? That happens in only 3% of births. So it's kind of helpful to remember that there's usually time to labor at home, especially if you're in those early labor stages. There is a huge difference, obviously, too, between early labor and active labor. If you want the epidural, then that may change when you go in, but most people can kind of wait until that 5-1-1 or even 4-1-1 rule or ratio that people tend to rely on. I don't love the idea of like focusing on like timing contractions the entire time. It definitely takes you out of like your zone, but it's still helpful to know like if they're coming kind of frequently.
Yeah, and they're different for everybody too, I've noticed. Like even people that have them like 2 minutes apart or whatever, like it's still, you know, that doesn't mean that like you have to rush to the hospital. That can last for a while. So
it's I think a lot of times it's about the intensity. Things could be 4 minutes apart for hours, but you might still be giggling through things and you might still feel like baby's pretty high. You're not feeling any pressure in your pelvis. So like talking through like it's not just the ratio. And I've had people who they don't get closer than 6 minutes apart all the way through pushing. Yeah. And it's like typically we see them get anywhere from like 2 to 3 minutes apart during the pushing stage, but it like I don't know, it's hard to kind of just base it off of numbers alone, and we're already a little number happy and we always want something tangible, but it's helpful to kind of like hold that loosely. But most people tend to head in around that 5-1-1 or 4-1-1 rule.
Explain what the 5-1 and 4-1-1 is.
Yeah, so 5-1-1 is like contractions are 5 minutes apart, they've been lasting a minute long each, and it's all been going on for an hour or more. Or more is the thing I like to keep in mind. Right when you hit 60 minutes and they've been 5 minutes apart, it's not like you need to rush, but it kind of depends on like the intensity. And then 4-1-1 is basically the same thing except 4 minutes apart, lasting a minute long each, all been going on for an hour or more.
Even with intensity, I've seen too that sometimes, you know, some women don't experience any intensity at all, and they're like, oh, like I feel okay, and then they're like, oh gosh, the baby's head is right there, and they end up having baby at home or something. But
right, yeah. So it always depends too on like how comfortable would you be with a spontaneous home birth, right? If that is like, I don't know, maybe then look into that. But also if you're really wanting to avoid it, if you don't feel safe giving a birth at home, or you feel like you aren't prepared for that or whatever, then definitely pay attention to like the pressure and sensations you're feeling, because even if you're maybe coping well, it's still good to know what to look for those really late stages of where you're at. So obviously any like strong like pelvic pressure that's been pretty consistent, or anything vaginally or rectally like pressure wise you're feeling, those are usually indicative that it's time to head in immediately. Because you might be starting pushing stage soon. But even just taking like a birth class and communicating with your partner and your doula about different things to learn for like strategies on early labor versus active labor. Even some people do like to appreciate that early labor transitioning into active labor and still trying to stay in their rhythm at home before they just start rushing. I think it kind of helps with like getting that pattern like established, and then feeling like you found your rhythms for coping before heading in. Also, things can kind of peter out a little bit too. So it's like, you know, I've seen people who get all excited. They're like, oh, I think I'm at the 5-1-1. I think we're going to head in. And then the second they start to like head towards the door, things slow down a little. So it's like, just wait until things are really consistent. And then definitely be open with your provider too about your wishes, and have them make suggestions based off of what's important to you about how long you want to labor at home and stuff like that.
Yeah. Of course, laboring at home tends to be more comfortable. A lot of people really feel safer at home and that sort of thing. So, you know, they want to kind of stay there and just connect with their partner, or if you need your doula there earlier, some doulas will come during early labor too, just to kind of, answer any questions you have or anything like that. And then it also helps you get into rhythms, and so your chances of, have that car ride, and going to the hospital, the admission into the hospital, impacting contraction pattern is less likely. So when you get to the hospital, of course, using your BRAIN acronym and the 6 steps of healing, which we talked about in episode 2, that really, is important to once you're getting there. So you can establish what your wants and your needs are, and what you want, don't want, that sort of thing. And then studies have shown that having a doula is also really great. So who is not employed with the hospital is always beneficial, and can have potentially change outcomes relative to risk shift. So decrease your risk of cesarean birth by 39%, increase your likelihood of spontaneous vaginal birth by 15%, and then decrease the use of any medications for pain relief by 10%, and then in some cases shortening labor to an average about 41 minutes, and then decreasing the risk of just being dissatisfied with the whole birth process by 31%. So really impactful numbers.
Massive.
For sure. Yeah.
Mm-hmm.
Yeah.
And I feel like I get excited when people find the evidence and then they come to us during like a consult or something and they're like, I've seen like studies can decrease the risk. Obviously we can't guarantee outcomes.
Of course, yeah.
We can do our best to help you like with the goals and the hopes that you have for your birth experience, but it does bring a lot of comfort to people to know that they are supported by this doula, this person that's hired by them for them.
Yeah, not for the hospital.
Right.
Like the doulas work for
Right.
you, not for the hospital.
Right.
The
It's
staff.
nice to have that separation and
Yep.
it's this familiar face that you've met in advance and you know will kind of visit you postpartum. Yeah.
Yeah. Definitely good stuff.
Yeah. And I mean, the people in your room, obviously that matters a lot. So, I mean, let's talk about nurses too, because we focus a lot on the provider,
Right.
the choice and how to pick someone, and you work with them prenatally. And we talk a lot about like how to choose your provider in episode 5, but the nurse is really the member of the hospital staff that you're going to see the most. So, I mean, picking and managing that relationship is a good thing to keep in mind when it comes to trying to give yourself the best chances of an autonomous birth. But most of the time, the ratio for nursing staff to patients is like 1-to-1. So when you're in labor, usually it's one nurse is assigned to you and nobody else. Some places, if they're busier or understaffed, or if it's just not their setup, they might not have that 1-to-1 ratio, but it's usually pretty standard. But you could always ask ahead of time, especially when you're doing the tour. But they typically do like 8 or 12-hour shifts. So it's sometimes good to kind of keep in mind around 7 a.m., 7 p.m., you'll probably see some sort of change. So if you've really liked your nurse, or if you didn't really like your nurse, it's like either a light at the end of the tunnel or it's that like mentally prepare yourself that your favorite nurse might be heading out. But even when you're on your way over and you've already called them, letting them know that you're on your way, or when you're being admitted, you can kind of tell them what you're looking for in your doula, like in your nurse, like who is going to be the best fit for you. Is it someone who gives you space? Is it someone who's super hands-on and helpful? Is it someone who is good at like positioning? Someone who will be like funny or calming? There are definitely different personalities to nurses, just like doulas and partners and providers. But yeah, that's always, I feel like, a really helpful thing to think about is just like right when you get there, or when you really liked your nurse or are getting a new nurse, you could always kind of put some feelers out there for, hey, you should pick somebody for me that's coming on that would really match what you think we most need. So you can kind of ask them too to keep in mind who would be a good fit for you rather than just more of like a random assignment. And then definitely lean on your partner and your doula to help amplify your voice when it comes to communication with nursing staff, especially because your partner and your doula will have known in advance what is most important to you. And so it kind of helps with that ease of the transitions and the communication.
Yeah. Yep. So yeah, kind of back to the doulas too. The doulas are there to like work with the nurses. So there's a cohesive, relationship that is happening there. And a lot of times they are really appreciative of that there's a doula there because it really lightens the load for them.
Mm-hmm.
So, if there's comfort measures that, that need to be, put in place, like they don't have to do those things, or doula can do them, or your partner can do them, or there's just like someone there other than them and they can go, because their caseload can be kind of big sometimes. So just having that extra person there to like even help clean up some things, or get stuff out of the way, or again just like be that extra support, they really appreciate that. So and then ways to have your partner involved, which is very important. Of course, we don't want to exclude the partner. They're really there to be a part of the birth team, and they're again the ones that know you the best. So besides hands-on support with positioning or coping strategies, you can get on the same page with your partner. about your wishes and your preferences ahead of time in conjunction with your doula, of course. And then review your birth preferences or your birth plan with them, which you're kind of doing together, anyways. So, and then discuss scenarios to prepare for communication tools, maybe asking your doula for tips and tricks here as well. And explore what you might be comfortable with your partner doing, and if do you prefer them communicating to the hospital staff, or do you prefer your doula doing it? Like, do you want your partner to kind of focus more on supporting you and that way have your doula, or do you want your partner really being the one to be, the voice and advocating for you? So if that's needed, and then if you're and then, of course, tell your doula ahead of time, like, what your preferences are. It's really good to keep that communication open. Mm-hmm. So yeah.
There's definitely different ways that your doula or partner would communicate. There are people who just are naturally more confident and direct. And there are other people that, not that confrontation or conflict is challenging, or maybe it is, but it's more like they go about it in a very gentle way. So you can kind of pick your doula based off of their communication style.
Yeah.
I know that I've had clients who are seeking a doula who is maybe gentler to soften how they feel like they might be communicating with the staff. They're like, I need someone to soften how direct I'm going to be. Yeah. And I've had other people who are like, listen, I'm a people pleaser, or I'm really bad with conflict or telling people what I need. I kind of need someone to take the initiative and to kind of step in. So that's something to think about too when choosing a doula, when kind of talking with your doula and your partner about communication styles. Do you feel like you need someone to offset you or fill in the gaps that you feel like you're not going to know what to do or how to do it, whatever.
Yeah. But. So definitely some doulas will go to bat for you if you want them to. So you don't be afraid to when looking for one, if that's what you need, or again, if you want someone that's going to kind of just, relay it in a more gentle manner if you're a more stern person. So
are you familiar with Lord of the Rings?
Oh, yeah.
Okay. Just checking.
Obsessed with Lord of the Rings.
Okay. I had done a post a while ago. I had a client who had said they thanked me for being their Gandalf.
Yeah.
And I was like, that's such a good analogy, is there are definitely different ways that someone can be your doula. I'm sorry if we're making Lord of the Rings references and
sorry,
you're not
sorry.
getting it. If it's not for you, that's fine. But basically, Gandalf helps to lead the way and protects, and you shall not pass. It's very he can be a very strong leader and guide and that type of thing. So
I'm going to use that now.
I highly recommend. And that's sometimes when I know that someone has familiarity with Lord of the Rings, I can ask them, do you need a Gandalf or do you need a Samwise Gamgee? Do you need someone who's going to I can't carry it for you, but I can carry you. Do you need someone who's not going to lead the way, but walk with you and kind of follow you as you're leading,
Right,
so sometimes that's a good.
Oh, I like that. I haven't thought of that before.
Yeah, it's a good distinction of the communication or the types of support. So that might even kind of blend into the nurses that you have. Do you like someone who's very good about being proactive, taking charge, and helping to guide you, or do you kind of just need a nurse who's supportive of the rhythms that you've already established or whatever? But
yeah. Mountains Gandalf. Sorry, I had to add that in there. My partner and I, every time we go hiking, we'll see a view and we're like, mountains Gandalf. So whatever.
That's funny.
Yeah.
I'm not I'm not. I think I'm more into Harry Potter than I am into Lord of the Rings.
Yeah, we like Harry Potter too.
Cool. But I definitely cannot talk about personalities and communication styles in the birth room without bringing up that example. I feel like it's super
that's
helpful.
Awesome. I love that. That's great.
Yeah, and I think something that's important to note too is a lot of times when we're thinking about autonomous birth in a hospital setting, a lot of people ask and wonder about hospital policy. Okay, well, I want to do it this way, but they say that this is what they do or this is their policy. And it's really helpful to make the distinction that hospital policy is not law. It's something that's put in place to protect the hospital staff and providers, mostly from any liability or any litigation.
Right.
So it's kind of guidelines that they are trying to follow to reduce the risk of all of that.
Yep.
I feel like when I was on my honeymoon, I read this book called it's pushed by Jennifer Block.
Life of a Doula.
Life of a Doula. Like, I'm like, this is what I'm reading as we're like sitting on we had like a Smoky Mountains, Tennessee cabin,
Oh,
you know,
beautiful.
we
That's
went
nice.
like horseback riding and did like all kinds of like fun
My
stuff.
kind of honeymoon. Yeah.
It was
like
great.
that.
It was
Yeah.
great. But it was like COVID time. So we kind of just like really it was very restorative, but this is what I would read on the porch, during the early hours of the morning. But, it was a fantastic read, especially if you want to learn more about how the shift happened between like that huge surge of policies that became kind of more implemented over the last like 50 or 75 years. Like their fear of like breech birth and like one case really can shift tons of policies.
It can, yeah.
Yeah. So yeah, but it might be helpful if you're interested in that kind of history. But when you are in active labor, the hospital is legally required to care for you. So if you are like not on board with the policy that they have, or you're not wanting to follow something that they're recommending, they can't kick you out. They can't decline, like they can't just be like, okay, well, we're going to have to boot you. You're going to have to transfer out because you're not, getting out of the tub when we want you to, or whatever. But I think there was a helpful post, like a blog post that I saw from Lamaze when I was doing some research on this like a little while ago. And they had given a good example about, say, for example, when you get to the hospital, most of the time they want to do some sort of monitoring or have you in the bed at the beginning to kind of like track and trace where you're at. But if you prefer to walk in order to progress labor, or just cope, because movement's really great, of course. And the nurse is telling you it's hospital policy for you to be in bed for whatever reason, monitoring or whatever. You can ask them, oh, could I please see the rules? I'd like to kind of talk about this. It's my understanding that it's my right to negotiate what these are, and it's my responsibility to, it's now my responsibility if I'm deciding to kind of go against it. And then they can have whatever opinion or, reaction that they want, but in reality, they can just document that you're declining that and whatever. Sometimes they get more people declining policies than they led you to believe. Like a lot of people are like, no, thank you. Like I'd still like to be up moving. Let's try to track me that way. Or I'd rather sit in the ball than in the bed. Like there are alternatives, and it's helpful to know that those do exist, and they are used to adjusting and adapting, and some are really great about it too, so they might surprise you, but let's hope that you're surprised by how receptive they are. yeah
definitely. All right, so also environmental factors are another thing that play a huge part in it too, so such as like the lighting. So you don't have to have like crazy fluorescent lights blaring in your face. You can certainly shut those off, set up LED candles, or have it dark, whatever you want. And then sounds, like, if there's beeping of monitors, you can ask to have those shut off. They don't have to be on. And then you can play music if you want. If there's talking, you can ask people to be quiet, or if you want people to talk to you, you can do that too. And then the amount of people that are in the room is another thing. So if you don't want like observers and students, or you just like want you and your partner or the doula, you can totally ask for those things. A lot of hospitals I have seen that the nurses will just leave the room unless they're needed. So you can totally have that done too. And then adding aromatherapy is also a nice touch too, just to kind of, again, set that kind of undisturbed feeling. That's, what the environment is really there to do. So you can still request all these things and have them done, and there shouldn't be any problems about that. So yeah.
Really anything you can do to think ahead of time about what will make you feel safest, and what will give you the autonomy that you're looking for. That's kind of defined differently by different people, but this is a good time to think about what it means. Like if you are planning to give birth in a hospital, or you're kind of trying to keep it on your radar just in case of a transfer if you're out of hospital. Just thinking about which of these things are resonating most. If we forgot anything that you're like, oh, you know what, this is so part of my birth plan, I know I want X, Y, and Z, then like send us an email, drop in a comment on any of our posts. We'd love to chat about it, because everybody defines autonomy in a hospital setting differently. But
Yeah, definitely. And this is, just a great episode for those that are, maybe if they did want like, birth center or home birth or something like that, and they can't because of high risk issues or medical conditions or something like that, you can still absolutely have an autonomous birth in a hospital. So yeah, definitely.
Yeah.
All right. So I think that's all for this episode.
Yes, ma'am.
All right, cool. Well, thanks so much for listening, and we will definitely catch you next week. Be sure to like, subscribe, and comment, whatever you want to do.
Yeah.
We so appreciate it. So thanks for watching and listening.
See you later.
We'll see you next time. Bye.
Bye. That's it for this topic. Thanks for tuning in. Check out the show notes for any resources or links that we mentioned today. Make sure to subscribe and follow us on your preferred podcast platform, and also be sure to give us a review.
It really helps us grow and reach more people who could benefit from this info. Also, check us out on YouTube and visit our blog where we have this podcast transcribed for you.
We'd love to connect over social media too, and we're just an email away if you have any questions or if you want to request a topic to be covered.
We hope this helps your mind, body, and soul in having the supported and holistic journey you are so deserving of. Embrace the power within you.